So for the clinical presentation of malnutrition, we are going to use the SchrDbb algorithm, where we are going to start with the disease, and in this case the disease is malnutrition, and the classification of the disease is clear. So we're going to speak about that. So after speaking about that, we now move to the next part, which is going to be the cause. You need to find the clinical presentation of the cause of the malnutrition. You need to find the physical examination, the clinical presentation of the complication of the malnutrition. You need to have the risk factors for the malnutrition, and you have the background. Generally, risk factors for malnutrition are going to be under the cause of the malnutrition. Is it clear? So those are and the prognosis now of the malnutrition. You need to know that the malnutrition that has the poorest prognosis is the severe acute malnutrition. Is it clear? Severe acute malnutrition. This is why this patient need always to be admitted in the ward. Is it clear? They need always to be admitted, and then you do the treatment of the malnutrition inside the ward. Is it clear? Now let's start with malnutrition. You need to know that actually malnutrition, as we said, is divided into overnutrition or undernutrition, but in this case we use malnutrition as undernutrition. Is it clear? Undernutrition. But now, how do you diagnose undernutrition? So you need to know that undernutrition, on physical examination, the child is going to be inappropriate for age. The eye is inappropriate for age. Is it clear? For age. Now, you go now to diagnose undernutrition, you use the Z score or the WHO score. Is it clear? And then you go on the graph for weight for age. You go on the graph of weight for age. You have different ages from 0 to 6 months, 6 months to 5 years, and then after 5 years. So those are the different weight for age that you have. Is it clear? Now, you are going to have different graphs where there are lines like this. Is it clear? Is it clear? Now, you need to know that undernutrition is when the Z score is going to be, if you plot and then it is less than, it is as from -1. So if it is between -1 and -2, is it clear? You already know that that is undernutrition, and it is already mild undernutrition. If it is between -1 and -2, it is undernutrition. It's already mild undernutrition. Now, if it is less than -2, it is already moderate undernutrition. When it is already less than -2, it's moderate undernutrition. And then there's another line. If it is less than -3, it's already severe undernutrition. Is it clear? So but the best way to characterize the severity, I'm just going to explain it later. So that is to know if the malnutrition there is actually an undernutrition or not. Is it clear? To know if there is an undernutrition, just go on the Z score or the WHO score for children less than or equals to 5 years. But now, if a child is greater than or equals to 5 years, you can either use the weight for age, or you still use the BMI for age. Is it clear? And it's still having the same elements like the Z score, where you are going to use the less than 15 percentile or use less than -2 or -3 for the diagnosis of malnutrition. Is it clear? Undernutrition. So after diagnosing undernutrition, the next element to know is going to be the timing of the malnutrition. Timing of malnutrition. Timing of the undernutrition. Now, you want to know if the undernutrition is acute. Is it clear? If you want to know if the undernutrition is acute, you go on the Z score, which is having the weight for the height or the length. Is it clear? You go on the Z score to plot the weight for the height or the length. Is it clear? Now, when you have low, when the weight for the length, or you are going to have this your graph. Let's say that this is the normal zone. The normal is there. Here you are going to have -1. Here you have Z is equals to -2, and you have Z is equals to -3. So when you plot and it is in between -1 and -2, is going to be mild problem. Is it clear? And when you have a low weight for height or length, it is called what? It is called wasting. Is it clear? It is called wasting. So if you plot, it is between -1 and -2, it is called mild wasting. Is it clear? If you plot, it is between -2 and -3. It is called moderate wasting. And if you to plot, it is less than -3 on Z-score. It is called severe wasting. Is it clear? It can also help you to know the severity of the malnutrition. Is it clear? But wasting is important. When immediately there is wasting, it means that the malnutrition is acute. Is it clear? Now the next element, if you want to know if the malnutrition is chronic, is it clear? If you want to know if the malnutrition is chronic, you use now instead the plot of the height for the age. Is it clear? Let's say that the normal line is as such. You are going to have the -1 line here, you're going to have the -2 line here, and you have the -3 line here. Here is the normal line. Is it clear? Now let's say that you plot the height for age. It is between normal and -1. It means that the child is normal, has a normal height and appropriate for that age. If it's between -1 and -2, it means that the child has mild something. Is it clear? You need to know that when you have low level of height for age, it's instead called stunting. Is it clear? When you have low level of height for age, it is called stunting. So when you are between -1 and -2, it's called mild stunting. If it's between -2 and -3, it's called moderate stunting. If it's less than -3, it's called severe stunting. Is it clear? So those are the different elements that you have to take into consideration when you want to diagnose this. Now, if you want to know an acute on chronic malnutrition, is it clear? What you have to know is that you have both wasting plus stunting. So immediately you have wasting and stunting. That is an acute on chronic malnutrition. Is it clear? Now the next element are going to be the how to evaluate for the classification of malnutrition. To evaluate for the classification of malnutrition, or to evaluate for the clinical, based on classification based on the clinical sign, we said that there was either kwashiorkor or there was marasmus. And we have already explained what was kwashiorkor and marasmus. We were visualizing the classification of malnutrition. Is it clear? You need to know that what generally kwashiorkor is associated with edema. We are going to have ascites. You're going to have pedal edema, but the skin texture is going to be same because there is fatty content in the case of kwashiorkor, but there is low level of proteins. Is it clear? So you're going to have a moon face. You have normal skin texture. In kwashiorkor, you need to know that kwashiorkor most typically is going to mostly occur in cases of acute circumstances. That's why I've initially explained that in severe acute malnutrition, you're going to have fluid retention. Is it clear? So you can have a form of kwashiorkor that is not having low level of protein, but is instead having a high level of salt retention occurring in acute cases. So you can have acute kwashiorkor occurring acute edema in severe malnutrition. So kwashiorkor can occur in acute cases, and when it occurs in acute cases, it is the edema is mostly as a result of salt retention. I hope you're understanding. So the kwashiorkor can occur in acute cases. That clinical presentation of edema and all this can occur in acute presentation. Basically, when it is acute, it is as a result of salt retention. So there is low level of protein and there is salt retention. Is it clear? So that is how you have acute kwashiorkor. Kwashiorkor mostly occur in acute presentation because of salt retention. I hope you're understanding. Now, the next thing that you have to understand is the case of marasmus. Marasmus is going to typically be in a case of chronic malnutrition. Is it clear? Because you have both protein and energy. So in this case, they are going to have features of wrinkleness. You're going to have features of simian face of the O or the Oman face. It's mostly occurring in case of chronic malnutrition. Is it clear? So if you have a patient with kwashiorkor, it's mostly acute malnutrition. If you have a patient with marasmus, it's mostly chronic malnutrition. If you have a patient with marasmic kwashiorkor, then it's mostly a case of an acute on chronic malnutrition. Is it clear? So those are based on the clinical classification of kwashiorkor and marasmus. So now, after visualizing all this, we need to also know the clinical presentation of the pathogenesis.